Hello, my name is Mayara Figueiredo, and I will present a short summary of our paper, Using Data to Approach the Unknown, Patients and Healthcare Providers' Data Practices and Fertility Challenges. Our study investigates how patients and providers engage with self-tracked data in fertility challenges. To explore such question, we conducted interviews with 14 patients and 5 infertility specialists. In this talk, I illustrate patients and providers' different data practices through a scenario based on different participants' data. You can refer to the paper for more details, but here we will talk about Lucia. Lucia was 24 when she started trying to conceive, but she did not get pregnant for many months. She decided to start tracking her period dates and temperature using Excel, just kind of lightly tracking stuff, not super committed to it. She conceived but lost her pregnancy, which was a very difficult experience. This experience led her to track more, to try to understand why the miscarriage happened and to avoid it to happen again. She started using Excel and a fertility software to track period dates, temperature, cervical mucus, intercourse, symptoms, ovulation tests, and cervical position. And as she says in this quote, she had months of data and she got really obsessed about it. After more than a year trying by herself, she consulted with an infertility specialist, Dr. Jones. Dr. Jones asked questions about her periods but did not analyze her spreadsheets. She did her own tests and suggested a treatment with medication to simulate ovulation. Lucia did not really understand her reasoning, but she did the treatment. She also kept tracking some indicators just in case. After 4 unsuccessful cycles, she was very frustrated with her doctor because she could not even find a cause for her challenges. But for her surprise, Lucia finally conceived in the 5th cycle of treatment. This scenario illustrates how patients' data practices are entangled with their emotions and how their trajectories often involve different data, different types of data, different treatments, healthcare providers, and often difficult fertility-related events. It also illustrates how fertility is uncertain, or in the words of our participants, how it is unknown. Fertility is extremely complex and poses a lot of uncertainty for both healthcare providers and patients. As shown in the image, there are many factors contributing to the unknown in fertility. We identify that both patients and providers use data to approach this unknown, but they do it in different ways. Patients use data in an exploratory way. They see data as a means to learn about their bodies, to understand why they are not conceiving, and to increase their chances. They often track a combination of multiple types of data, including period dates, ovulation tests, and lifestyle measures. Finally, patients' data practices are often not only involved, but driven by their emotional experiences. Providers, on the other hand, use patients' personal data in a much more structured way. They use data to follow a protocol guided by scientific knowledge and probabilities to define the best treatment. They use very specific types of data, basically period dates and the results of ovulation tests, which they align with laboratory and radiology tests they conduct. And their practices are largely driven by medical rationality. It is easy to see how these different practices can clash. Like Lucia, patients may feel confused and disappointed when providers do not explain how they make their decisions or what data they use to make them. While providers like Dr. Jones often have to deal with extensive data that they do not directly use or need. But despite these conflicts, our participants also provided information on how these practices can work well together. Based on these descriptions, we argued that these practices are different, but they also serve different purposes and have unique benefits. On one hand, providers' data practices are useful to define the best treatment course. It is not feasible to expect providers to analyze months of data, and impose such high levels of personalization may impact or delay cases that would be easily supported by the current protocol. On the other hand, patients' data practices help them to learn about their bodies, which is also good for providers, and also provide them a sense of control that is important to cope with the disruptive experience of infertility. Completely changing patients' practices to mimic providers could then hinder these benefits and hide the personalized aspects of their trajectories that can point to exceptions to the protocol, which do happen. So in the paper, we suggest that in this case, it may be more indicated to connect these different data practices without merging them. And we provide some open suggestions on how technology can support this bridge by, for example, making providers' data practices transparent and visible to patients as early as possible so they can get used to them. Helping providers consider different types, different trajectories and help patients to showcase the information that can support that. supporting providers in addressing patients' emotional involvement with data, and finally, exposing how much is known so patients can have clearer information to balance their expectations. And that's it. For more information, please refer to our paper and feel free to contact me. Thank you so much for your attention.